Have you ever had a headache so bad that you have throbbing pain, pulsating pains, your eye feels like it's going to pop out, pain down the neck, nausea, vomiting, horrible pains that you cannot ignore? Headaches or migraines have been misdiagnosed for years. Sometimes people think that migraines are a sinus infection. They go to the doctors and they demand antibiotics to try to treat their sinus infections. But most of the time, it's a headache that is a migraine. I get migraines. I've been getting migraines since I was like 10 or 11 years old. I remember my mom tying something over my head because that's the only thing that would make it feel better was to put pressure on the head, and it was horrible. I had to take Tylenol and Aleve and several medications to try to get the migraines to go away. Today I'm going to explain migraines, what migraine is, how to treat migraines, and the triggers of migraines. A migraine is a vascular headache that lasts at least 3 to 4 days, or you get one at least 3 to 4 days out of the week. Migraines are caused by abnormal brain activity. They are very unclear, so it's very hard to diagnose and to treat. They believe that migraines begin in the brain. Sometimes they feel like there's abnormal nerve pathways or chemicals that could possibly be causing the migraines. And they also think that it affects blood flow to the brain as well. Symptoms of migraines are throbbing, pulsating pains, nausea, vomiting, visual disturbances. This right here is a picture of a visual disturbance. Some people actually see this kind of stuff before a headache. These headaches, some people see dots or they see things prior to a migraine, and they can sometimes treat the migraine before it actually gets real bad. My migraines, I don't get these. Usually my migraines, they come and I don't know when they're coming, and I get sick to my stomach, vomiting, and I get headaches that are like pulsating where I feel like I'm having contractions in my head. That's how bad they are. When you're diagnosed with a headache, the doctor will educate you on the possible triggers. Triggers are hormones, can be triggers. There's smoking can be a trigger, foods, bright lights, loud noises, weather can cause migraines, certain odors, fatigue, lack of sleep. Like if you don't sleep, your sleeping patterns are different. Like if you normally sleep 8 hours a day and then all of a sudden you sleep 4 hours a day, if your sleeping patterns aren't the same, that could be a trigger for a migraine. Also, migraines run in families. My mother used to get migraines, and so migraines are hereditary. And then overuse of medication can cause migraines. Lots of people take medication every single day. That is overuse of medication. So you can get a rebound headache from medication. According to the Consumer Reports on Health, some drugs are more likely to cause overuse or rebound headaches than others. Butalbital and opiates are among the riskiest, along with triptans and over-the-counter pain relievers. Treatment for medication. This picture is just over-the-counter medications that several people use. There's abortive medications such as triptans, pain medication, and non-steroid anti-inflammatory medications. Usually they take these medications when they get an onset of a migraine. There's also preventive medications such as blood pressure medications, antidepressants, and anti-seizure medications. The way to identify your migraines, this is a treatment as well as to identify your triggers. They believe that if you have a headache diary and you explain when you get a migraine, how long the migraine lasted, that's a way to help treat your migraines. According to the New York Times, they often recommend that patients keep a diary when and where headaches occur, Keeping a diary can also help when you sit down with your doctor. The more you know about when a headache occurs, what seems to trigger them, and what they feel like is easier to diagnose and to treat. Another treatment is stress reduce. Make sure you get a full night's sleep. Make sure you eat a balanced meal every day, and exercise also helps your migraines, like yoga and meditation. Migraines can be defined as a limiting headache that can stop you from functioning. The pain is not mild, and you definitely cannot ignore it. According to the Harvard Health, people with migraines may look like complainers, but after learning a little bit about migraines, I hope you now understand that they are more than just a headache.